increasing the role of privately delivered but publicly funded care isn't good for anyone.
Privatized for-profit healthcare. Coming to Canada. Can't wait. Well, you knew it was coming. Ontario Premier Doug Ford's solution to the healthcare issue is apparently, yes, to introduce privatization, forcing the province to pay more to line the pockets of wealthy healthcare executives. Understand this is how this works. I'll get to more details here in terms of the breakdown of the plan. I will discuss the one big issue that their plan does not at all address. And I will also discuss why Doug Ford chose this route, though it's pretty obvious. These lobbyists have been lobbying him for quite some time. He's good friends with these privatized healthcare executives, and well, he is handing them a ton of money. So let me get started here. Now, this is, of course, been foreshadowed, discussed for quite a while. We all knew this was coming if you paid any attention at all. This is why people were, trying to ring the alarm bells about more Doug Ford, but you get what you vote for. So this from Canadians.org. In February 2022, Ontario Minister of Health Christine Elliott announced the Progressive Conservatives' plan to privatize public hospital services, opening the doors to for-profit clinic and hospitals. The Ontario Health Coalition has outlined that for-profit care delivers poorer quality services, cuts corners, is under less regulatory oversight, and costs more. It also widens the gap in health equity, as patients who can pay out of pocket are able to get faster service. And of course, I have done a lot of coverage on the American healthcare system, the for-profit private healthcare system, a complete disaster of a system in terms of the amount of money put into it and the outcomes. They are the worst. And Doug Ford looks at America and thinks, you know what? I want a piece of that action. So let's get into what is in this garbage, shall we? This quick breakdown here. I'll link to this below the video. This is from the Canadian Press, so you can read through all the details there. But a quick summary. They are bringing surgeries at private clinics, increasing the number of publicly covered surgeries performed at private clinics. Again, understanding this is not a private option, so there isn't even the potential benefit of, I guess, offloading the wealthy people to the private system. No, we are talking about private clinics billing the province, paying more for less, when you could just invest in the current system. Also in this plan, long-term care changes. While patients wait for their preferred home, they can be placed in a home not of their choosing. Yeah, great idea for the elderly to be placed somewhere where they don't want to be. Expanding non-emergency paramedic services. Instead of going straight to the hospital, it allows paramedics to treat patients at home or take them to a different care center. I don't see any issue with this. Maybe there's an issue with this. So if you're in the healthcare system and there's a problem here, let me know, but I think this is fine. I don't see a problem with this. And also expedite the licensing of foreign trained nurses. Again, I see no issue with this either. This has actually been a problem for a while, but there is a missing piece here, and that is they are putting more nurses into a system where Bill 124 exists. So I'm going to get to that, as that is the main issue here that is not being addressed by this plan. But first, I want to get to the reaction, this reaction here from Dr. Nellie Kaplan-Myrth during her interview with CTV News.
Was there anything in the plan today, it's called the Plan to Stay Open, that you liked, that you saw as a positive step?
No. What we needed to hear from the government, what we needed to hear from Sylvia Jones is that we are going to focus on solutions that support public health care, that are focused on prevention and being proactive rather than reactive. There was no mention whatsoever of family medicine, of the importance of primary care in the community. You want to keep people out of hospital, you need to support primary care. We need to reduce the burden on emergency rooms and specialists and improve population health. None of that is in their plan. The fact that the government is looking for ways in which to boldly privatize medicine should be a red flag for anybody in Ontario who doesn't have the privilege and the wealth to buy themselves care.
And that last point there is a very important point to understand, that this is how it starts. So yes, there isn't an American style, private option at the moment, but you begin to get people acclimated to more privatization while starving the public system. And then you go and look and say, oh, look, public system's doing terrible. Yeah, because you starved it. Meanwhile, you get people, again, more accustomed to a private system, and then you get to a point where you do begin to offer some private options. And I'm going to give you a couple examples here of how that has not worked out in Canada in the past. So from Maclean's here, in 2016, Saskatchewan attempted to reduce its MRI wait times with a pilot initiative that offered privately provided MRIs for those willing to pay. The pilot backfired. Instead of becoming shorter, MRI wait times increased. And what better case study for the dangers and failures of a for-profit healthcare model than our long-term care and retirement homes? Study after study has outlined the alarming discrepancies in death rates and health outcomes between public and private long-term care and retirement homes during the early waves of the pandemic. Residents in private facilities were consistently shown to be at greater risk of dying from COVID-19. So, and in terms of, long-term care is a whole other topic, but that's an issue of our system that does have a private option, and look at the results there. Now, let's get to the one issue that or one of the issues here I saw no problem with, but it goes into what I want to focus on here, and that's Bill 124. So this from CTV News. Meanwhile, the CEO of the Registered Nurses Association of Ontario told CB24 the plan to increase the number of nurse practitioners and push internationally recruited nurses through the system is a positive move. Quote, the fact that they're finally tackling the issue of internationally educated nurses is important and must be recognized, Doris Grinspun said. At the same time, Grinspun said it was absurd that Bill 124 still exists and it must be repealed. So, what is Bill 124? Well, in 2019, the Ford government introduced and passed Bill 124, wage suppression legislation, negatively impacting registered nurses, nurse practitioners, and healthcare professionals. This bill limits wage increases to a maximum of 1% total compensation for 3 years. ONA also believes the bill interferes with charter rights to freely bargain. ONA has launched a charter challenge against this bill, meaning it also hampers their ability to strike and actually fight for what they deserve. So this has been a serious issue, especially when you compare, not especially, but the issue becomes more obvious when you compare how nurses have been treated compared to how the police have been treated during the same time frame. So according to the data by ONA, nurses' wages have increased by just over 15% over the last 12 years, from a max salary of $82,758 to $95,589 for full-time nurses with 25 years of service. This is compared to over 30% for both police officers and firefighters. The wage progression can be seen in this chart below provided by the ONA, and you can check this out. I'll link to below the video as well. You can see the progression there. But this really showcases the obvious discrepancy here, especially during the pandemic where we have, I think I could fairly argue here, we always rely on nurses more than firefighters or police officers. But regardless, to not even have parity, and all they are asking for is parity, to not even have parity with other public services is just a complete travesty. And it shows a level of disrespect towards healthcare professionals that other areas do not receive. Now, more on that. So to show you just how ridiculous it is to move to a more privatized system, this really breaks this down. So Michael Warner, who is an MD, he tweets out here, today's plan nibbles around the edges without addressing a core issue. Nurses feel devalued. Bill 124 is a gut punch. A workaround Bill 124 is agency work, meaning private agencies. Agencies up prices and are taking hospitals to the cleaners. The cost of care is up while further marginalizing full-time nurses. And he has some examples here. The math on privatization of nursing supply in Ontario. Since COVID, agency charges hospital $110 an hour. Nurse gets about $80 an hour. Public money going to private company per 11 25-hour shift, $337.50. Why is Ontario government funneling tax dollars to private companies instead of paying nurses better? So you see what's going on here, right? These, again, because these hospitals bill the province, that's how our healthcare system works, they are being forced here to use agencies because they're losing nurses, because nurses are being disrespected by the system. They aren't getting the pay that they actually deserve. So a lot of them are going to these agencies where they're getting paid more. But look at the discrepancy here. $110 an hour is what they're charging, but only about $80 an hour goes to the nurse, meaning there's a lot of money there in between that is lining the pockets of wealthy healthcare executives, private executives that don't need that money. There is no reason for the province to be making these people wealthy. That could be going directly into the system. The only reason to do this is if you've been lobbied by private healthcare industry, as Doug Ford has, and I'll get to that later on. But that's what's been going on. This isn't saving any money. This isn't benefiting anybody except for wealthy executives at these private agencies. And it gets even worse. I mean, the way they've upped these charges. So he goes on to write here, one agency charges our ICU $105 an hour per nurse. In September 2021, they charged $64.50 an hour per nurse. This 62.8% rate increase equals extra cost per shift of $455.62. Agency registered nurses cover 15 to 20 shifts per week. Extra cost for one ICU, just one ICU, about $7,000 to $9,000 a week, or $355,000 to $473 a year. Price gouging will bankrupt public health care. These private companies are getting away with, financial murder here, completely destroying our healthcare system while they get rich. And the only reason this continues is because the conservative Ontario government, with Doug Ford at the top of it, is allowing this, not just allowing it, enabling this, encouraging this. This is his solution to the problem. Pay more, get less. More here. So this year, the UHN, which is the University Health Network, which operates on Toronto Western Hospital, said it has spent just over $6.7 million on agency nurses. More than $4 million of that spending was tied to hiring private nurses to work in its ICU. UHN also released data about its efforts to hire and retain full-time nurses. At the end of July, the hospital network said it had hired 604 nurses, but it had also lost 331 by late June. UHN said since the start of the year, the network recorded over 1,000 vacancies. CEO Kevin Smith said there's currently about 600 active vacancies, nearly triple what it normally has. So to be clear here, they're comparing what they are paying in terms of these private agencies versus how they are losing full-time nurses on the public system. So they are losing nurses to the private system, to the private agencies, because, they're being paid more, they're being treated better in that sense, though there's less benefits. There is more flexibility, though, when it comes to these private agencies. But understand, in case you're wondering, why are there even private agencies of nurses? The initial idea was that, if there's a short-term need, say during flu season or during a pandemic where you need a lot of people immediately, that's where an agency is supposed to come in and then, serve whatever that need is. But now they're essentially being relied upon to do a lot of the nursing on a regular basis as opposed to just being there in case of emergency. And in the process of that happening, they are now charging these hospitals more because they know they can, because they need the nurses. It's a completely disgusting system. And you have the Ontario government here relying on this, again, paying more for less. Another example, Sunnybrook Hospital released similar data around the use of agency nurses, which was also published in an investigation by the Toronto Star on Tuesday. That hospital has seen a steady increase in spending on private nursing, with the annual totals climbing from $4.5 million in 2018 to 2019 to $8.2 million in 2021 to 2022. So almost doubling here in terms of what they are spending on private nursing since Doug Ford has taken office. As again, they have starved the public system and relied more on privatization. Now, there's too much reading, so I think this is just getting, summarizing a lot of what I already said, how a lot of these nurses are moving towards agencies for more flexible gigs where they're being paid better, and whereas they're being mistreated by the current system. But in terms of why this is happening, very quickly. You all already know. Here are all the corporations lobbying Doug Ford to privatize and outsource parts of Ontario's healthcare system. So this is a piece from Press Progress from back in May, and we are now seeing the fruits of that lobbying labor. So statistics from the Office of Ontario's Integrity Commissioner note that more lobbyists have registered to influence health policy than on nearly any other issue. 1,137 registrations aside from economic development and trade. Since the start of the pandemic, several media reports have indicated private virtual care, private health testing, and even private health facilities have grown enormously as a less regulated shadow sector of the system. And it seems many want to play an even greater role. And we are now, again, seeing the results of that. Last thing here, this is not any more reading, don't worry. I just want to give you there's so much information on this. And, I'm not a doctor, but I can present to you the information that I have found and what you need to know. And this is another part of that. So you can do this reading on your own. This is your homework. Go read this. This is a great piece in Maclean's. Our healthcare system is broken. Here's how we fix it. I quoted it briefly at the beginning here when it came to how privatization hasn't worked. But he goes on here, Ali Ahmad goes on to write basically what needs to be done. And it's not simply, putting more money in the system, which of course is part of the solution, but it's also how we deliver that healthcare and a different way of thinking about it. So I think it's a great piece. You can go check it out. Let me know what you think in the comments. But this is, again, my fear is this is the beginning. And clearly, at the very least here, the Ontario government isn't addressing the main problem, the one main problem. There are many problems, but the one main issue, and that is Bill 124. They are treating nurses like garbage while expecting them to continue working at these insane hours and making very little pay in relation to what they actually do and to how much we rely on them. And it's leading to a system where we are having these long wait times in emergency rooms, and a complete also lack of focus on home care, on family care, family doctors. Anyways, this is a very complicated issue, but one thing is clear. The Ontario government's only solution to any of this is to help their buddies out by lining their pockets.